You're watching Word of Mouth on ABC 27, presented by the Harrisburg Area Dental Society.
You know, hundreds of people who can't afford dental care get it for free. Deborah Pinkerton takes us to a place where that's happening.
You usually hear prayers and praise coming from inside Christ Lutheran Church in Harrisburg, but not on this day. Dentists with the Harrisburg Area Dental Society team up with Mission of Mercy and transform the nursery into a dental clinic. Dr. John Kiesling takes away the patient's aches and pains for free.
What's your name?
Khaldun.
Khaldun.
Yeah.
Khaldun Rashid is back for a checkup after having a tooth pulled.
And I got here at 5 a.m. I stood out there, the rain pouring down, but once I got in, it was all worthwhile. I'm thankful for this place because I don't know what I would have done if it wouldn't have been here because I was hurting so bad.
Dentists are here at this church every other week. They try to treat between 10 to 15 patients per visit.
Probably 75% of what we do is extractions here, but we also do another quarter of fillings and restorations to get the teeth back functioning.
State Representative Ron Buxton sees firsthand how Dr. Kiesling is making a difference.
In today's economic conditions and with health care on the front burner of our national and state issues, it's even more imperative that we get to the people who are underinsured and uninsured to have them realize that within their own communities, these physicians are dedicating and volunteering their services to help them.
Help people like Joe Morenchek.
Every time I ate something hot, ate something cold, something sweet, something sour, it just hit my tooth and it just sent pain throughout my whole body and I just couldn't take it anymore.
Joe doesn't have insurance, but does have a big problem.
A very large cavity, probably been there for a number of years, and I numbed him up very thoroughly so I was sure he wouldn't feel anything and extracted the tooth with really not that much difficulty.
The pain is gone. One more person healed, thanks to dentists like Dr. Kiesling.
To have this gentleman come in, I don't know if how he's getting paid or whatever, but just to come in and do this stuff is very nice of him. Very kind act on his part.
I just enjoy helping people in this way. I'm practicing in a wonderful profession. I have independence, life's been good to me, my family's healthy, and I thoroughly enjoy helping people that are in need.
And joining us now is Dr. Mariana Clardy. And Doctor, it's great that these dentists give time to Mission of Mercy. Do we have other free clinics for the people?
Sure. As part of our ongoing effort to improve access to care, we have dentists sign up at our meetings to provide free care either in their offices or in local community clinics. We're having one of those days on May 2nd at Hamilton Health. This is a great opportunity for us to provide free care to patients and also to complete exams to see if they have cancer of the mouth.
That sounds good. Now, what kind of services will be provided for people that go to this?
We provide emergency services primarily to relieve pain and suffering, but we also try to provide restorative care and preventive care and educate the patients as well.
Well, doctor, wouldn't a person have symptoms of cancer in the mouth?
That's a common misconception. Typically, people assume that if they had cancer of the mouth that they would have some symptoms, but usually there are no symptoms. The picture we're looking at is an example of an extreme case here, and many times cancer of the mouth would be a very small pinpoint area, nothing nearly as large as this.
So, yeah, now what are we looking at here?
This can be a cancer of the mouth can be a white area, a reddish area, or what we call a mixed lesion, which is both red and white.
Well, doctor, if a patient is diagnosed with cancer of the mouth, what treatments are available?
Well, that depends upon the type of cancer that's present and the depth of invasion of the tissue. Sometimes surgery is the only treatment that's needed, and hopefully we can find it in the early stages. Otherwise, sometimes radiation therapy and chemotherapy are required as well.
All right, so much more to it than just looking for cavities.
Absolutely.
When you go to the dentist out there. Thank you, doctor, very much. Let's go quickly back to the ABC 27 call center, Deborah Pinkerton.
Hey Chuck, we are getting lots of questions. One last viewer question now is, I'm missing a lower back tooth and my sister said I should look into getting a dental implant. Can you explain what an implant is?
An implant is like the root of a tooth. It would be placed very carefully and very conservatively in the jawbone in a very small hole called an osteotomy. And after a certain period of time, the dentist would put a crown on it, and that would replace the missing tooth.
Okay, great. Thanks so much. Thanks for answering the viewer questions today. And we also want to thank all of the dentists here, too, who have been busy answering your calls. We'll send it back to you, Chuck.
All right, thank you, Debberton. And Dr. Clardy, thank you very much for joining us here today. Dentistry has really changed since I was a kid. I think back, it wasn't a very pleasant deal. I'm 62 years old, and we went back here in the 1950s. It was not that big a deal. When you went in, we tried to avoid it. It was painful. There was no such thing as sealant. We never heard of fluoride. It was a tough thing to do out there. Is that encouraging when you sit down and patients come into you? Do you feel you have more weapons to deal with now?
Sure, I feel that we have a lot of resources available to us to provide care to our patients, and certainly even in the 12 years since I graduated, dentistry has changed a lot. I don't practice the way I learned to practice in dental school.
Okay, thank you, doctor, very much, and thank you for joining us today, and have a great dental day.